So here at ESMO and concomitantly published on the European Journal of Cancer, we presented data from the inflammatory breast cancer cohort of the Dana-Farber Cancer Institute. And we had 276 patients with either stage 3 or stage 4 inflammatory breast cancer, and we divided them into HER2-low and HER2-0 to understand if HER2-low harbored a prognostic significance and if HER2-low tumors had a different, let's say, clinical pathologic features compared to HER2-0. And what we found is that when you didn't account for hormone receptor expression, there was a difference in the aggressivity of the disease, because HER2-0 tumors had a higher PCR rate for neoadjuvant chemotherapy, and also survival, both disease-free survival and overall survival, were shorter for HER2-0 tumors compared to HER2-low. However, when we accounted for hormone receptor expression, we found very minor differences, both in terms of response to neoadjuvant treatment and in terms of disease-free survival and overall survival. And this is very comparable to the cohort, the larger cohort of breast cancer patients that we recently published on Medical Oncology, and that shows that when you account for hormone receptor expression, HER2-low expression doesn't seem to be prognostic and doesn't seem to characterize a distinct subtype of breast cancer. So among HER2-negative tumors, among HER2 non-amplified tumors, the biggest difference in terms of prognosis, clinical pathologic features, and any type of characteristics is related to hormone receptors expression.